Welcome to today's podcast episode, everyone. I've got a very exciting guest for you guys. For those of you just joining the podcast, we're E.N.G Media, and today I have Chuck with me, CEO and co-founder of Latitude Health. Chuck, I know that Ramon had introduced the two of us, my previous podcast guest, but just wanted to say thank you, and I appreciate you coming on to our podcast. Really excited to dive into all the stuff you guys are working on.
Of course, I'm excited to be here, Tyson. It's an honor to be featured, so I appreciate you having me.
Yeah, no, absolutely. As I mentioned, I am excited for this one mainly because I know that you've got, 15 years of experience in the healthcare field. And so what's always interesting to me is to kind of dive into our guest's background up to this point. Could you maybe give us just like a high level overview of kind of just what's led you up to this point of co-founding Latitude Health?
Yeah, I'm happy to. So, as you mentioned, I spent my entire career in healthcare as both an operator, an entrepreneur, and an investor. I actually started my career on the health plan side of the equation. I think I'm a little bit rare in doing that, but it was my first job out of undergrad and had the opportunity to join a leadership development program at a company called Amerigroup Corporation, which did manage Medicaid over 16 different states, got to rotate through every different arm of the business and really get a firsthand experience into what it's like to work at a health plan, where some of the bottlenecks are, how decisions get made, what actually matters.
Yeah.
From there, moved to Chicago and actually joined the founding team of a health plan called Next Level Health Partners. We grew that from 0 to 40,000 members, from the initial 6 employees that we had to 140 employees, and really focused on Chicago's Medicaid and dual eligible populations in the south and west sides of the city. And we're very much for the community, from the community. And in doing so, I sort of realized I was doing a startup without knowing what a startup was. A health plan is not a SaaS AI native digital health platform. It is a boots on the ground, knocking on doors, signing people up with clipboards kind of business. But all the general principles are the same, right? You don't have enough money. You're trying to stay in business. You're trying to grow the business, and you have to find ways and scrappy ways to do that. And you wear every hat.
Yeah.
And so that got my itch. I wanted to scratch my itch to get more into entrepreneurship. So I was living in Chicago, started to immerse myself more in the tech scene, joined a consulting firm called HealthBox, where we worked with large payers and large provider systems to help them define what they mean when they say they want to do innovation, and then go actually find the right companies, resources, strategies to bring into their organizations and help them adopt that innovation. Went back to business school, briefly went back to Anthem as director of innovation. At this point, Anthem had bought Amerigroup Corporation, but I really wanted to build. I wanted to work at a small organization. I wanted to work at a startup. And so packed up everything, moved to San Francisco, and about 6 years ago, joined a company called Clarify Health, where I had the pleasure of working with Ramon, your previous podcast guest, and got to take us on the roller coaster ride from Series A through Series D, wear pretty much every hat within the organization, from product to solution architecture to GM of our health plan business to actually leading our sales team in my last tour of duty.
Nice.
And then about a year ago, decided that I wanted to take the bet on myself. I saw the opportunity from the convergence of AI, my experience building and scaling SaaS software products, and my experience working in health plans to come over here and start Latitude.
Yeah, no, that is super awesome. What an interesting journey. And kind of why I'm excited to have you on the podcast as well is because a lot of our audience are mainly technical based founders that are coming more from the, background of engineering or actually building out the technology products of their companies. But I think it's interesting that you've been able to have leadership positions in sales at, healthcare organizations. And so I know you've had to be one of the key leaders at some of these startups to actually help them scale to that, the 40,000 members as you had mentioned. And so, my question for you is, what I've heard from speaking with folks like Ramon is that in healthcare, trust is so important. And a lot of business that is done comes from referrals specifically. Now, without giving away too much secret sauce, what would you say is, maybe one of the most important sales tips maybe you could give to a technical based founders that's trying to scale a company in healthcare technology?
That's a great question, because it seems to be a harder industry than most to get traction, but when you do get the traction, it's sticky. And what I would say is, to one of your points, like referrals, getting your foot in the door, I think healthcare is very much an industry that buys from other people within the industry. Relationships do matter. But the other thing that I would say that can be gotten around that, and it's sort of orthogonal to that, and I think why I actually had a lot of success in adjacent sales roles when I was at Clarified, is that I actually did have, at that point, the 12 years of experience of being on the other side of the table, of working at health plans. And so I was on the product side. I was building products around, network optimization, basically assessing the performance of doctors, like which doctors are high quality versus which are lower quality, building that into a suite of products. And we'd get in front of customers, and I understood the technology side of it, but I could translate it into and this is what this means for your business strategy at a health plan. When
Yes.
I was in your shoes, here's how I would have used this data. Here's how I would have used this to architect the best network, to do value-based contracting with these providers, whatever it was at the actually strategy layer. And I found that I was kind of taking this blend of not consulting in terms of like selling them consulting services, but more like the pre-sales consulting to say, this is all the value you're going to get out of this data.
Yeah.
And here's the playbook of how to do it. Here's some initial insights. And any questions you have about the data science, how the product is built, the backend infrastructure, I can also answer all of that because I built that.
Oh, wow.
And so it's sort of that combination, right, of having the deep technical product expertise, but then being able to parlay that into truly understanding who your customer is and trying to leverage that experience. So my advice, you can't really go back in time and get experience that you don't have, but you can surround yourself with advisors, and you also just need to talk to every customer, every prospect, have
Yeah.
as many conversations as you can, increase the surface area of your luck, but also just absorb everything that you're learning,
Yeah.
because you're going to get insights from that you can share with other prospects and be like, oh, hey, this is how another health plan that I was working with is thinking about using that data. I wonder if it would be applicable to you. So a long-winded answer of what my recommendation would be, but I think it comes back to truly understanding who your customer is and building that trust early on.
Yeah.
And then, of course, making sure you're solving an actual problem that they have.
100%. No, and I love that. I love that there's no real secret sauce to that. I think, a lot of leaders that I speak with in the healthcare technology space, companies that are doing some really impactful things with AI, almost all of them, no, I think all of them usually have extreme domain expertise in the field that they're serving, specifically, the problems that they're solving. And so it sounds like that overall strategy is what led you to be really successful in the sales positions that you've held. In the past 15 years, I know you mentioned before we talked on the podcast that you noticed that there was broken, I guess, utilization management workflows specifically. So I would love to dive into what I guess was the core area of focus for Latitude Health in coming in and leveraging AI to fix some of those broken workflows, leveraging your team's domain expertise. Like, were there any specific things that you guys have done and executed in the past year?
Yeah, there's a few questions in there, and let me take them in a little bit of an interesting order here. But you're right. So taking one step back, what is the problem that we're solving? So utilization management is the process by which a doctor requests some sort of service, a procedure, a surgery, a medication, a rehab center, whatever it is. That request goes to the health plan, and the health plan, your health insurance company, is determining whether or not that care is going to be covered. It's the process known as prior authorization. It has to get approved before the surgery can happen. And the point of is to make sure that care is appropriate and members do get the most appropriate care by looking at what does the clinical guidance say, what do the medical necessity criteria look like, and does this member actually meet the requirements for that? If they're looking for a knee surgery and the requirements are you needed to have tried 4 weeks of physical therapy before you have a knee surgery, that's actually a more appropriate treatment than, cutting open your knee and having a very invasive surgery.
Gotcha.
So now the bottleneck in this is that it's a very manual process. It's highly paid, highly trained clinicians that are control Fing their way through PDF documents if they're lucky to try to find the information they need in PDF clinical record that can be 30 pages to 500 pages long in some instances. And so while they're trying to do really heroic work in helping members get the care they need, they're basically doing it with one arm behind their back, given the legacy software and solutions that they have today. Now, the reason that I got into healthcare in the first place, and the reason why, now was the time to start this company, is that when I was in my early 20s, I had a severe eating disorder. And I spent 3 months in inpatient treatment, followed by outpatient treatment, followed by partial hospitalization.
Oh, wow.
And I'm a complete success story, right? My insurance covered the entire time that I was there. I got better. I did the mental work that I needed to, and I'm thriving because of that today. But my roommate in the inpatient setting, Will, was not as lucky. His insurance said that he wasn't being compliant with his treatment. They sent him home too early, and a month later, he passed away from complications of the disease. And behind that tragic outcome and that early discharge was a utilization management decision. And Will definitely should have gotten that treatment, but when you have somebody looking at a 400-page medical record that they're trying to decipher all the information they need, you inevitably miss critical things. And Will was a victim of that. So we built Latitude to make sure what happens to Will never happens again, that every member gets the right decision every time. But as a byproduct of that, health plans also get 3x the efficiency gains and 10x the ROI from administrative savings alone.
Yeah.
So we're really focused on helping both sides of that equation.
Yeah, no, 100%. I appreciate you sharing that story, and I'm sorry to hear about what happened to Will, but I think that it's an impactful story, and it completely makes sense, like how you guys were able to identify that problem and really what you're doing as well. And I know that you've got experience on the product and the technical side of things as well, but could you maybe speak to your team and kind of like what their role plays into the solutions that Latitude Health is bringing to the table? Like I'm sure you have some really talented team members. Is there any that maybe we could highlight on this podcast that's really driving your guys' mission forward?
Yeah, absolutely. So you're right that I'm dangerous enough on the technical side, but I'm certainly not writing any code these days.
Yeah.
I am lucky enough to have co-founded the company with my co-founder and our chief product and technology officer, Guru Nadigar.
Nice.
And Guru's basically the inverse of my background or the parallel to my background, but on the other side of the equation. Starting as a developer, moving into an architect, and then leading product across a number of different startups, as well as building some of the legacy infrastructure for the core utilization management platform at some of the biggest national health plans in the country. And
Nice.
so he's seen firsthand what it takes to build that, but also knows what we need to do to fix it. And
Yeah.
so he brings that background combined with the deep AI expertise that he's garnered over the past few years, given the emergence of generative AI and all the applications of that, to really put us together to create this winning team that allows us to have this deep expertise of actually working at health plans, understanding how the data flows, but also building and architecting an enterprise ready, scalable SaaS solution from day one.
Yeah.
And I would say that's one of the really unique things about the company is that there's a lot of vibe coding, there's a lot of quick ways to spin up apps. But when you're selling into health plans and security is an absolute must and you have to be enterprise grade ready, we've taken that approach from day one. So the platform is entirely secure, it's stable, and it delivers on the promises that we're building for our health plans of delivering that productivity while also having ethical and responsible AI built into that, such that
Nice.
we're making the right recommendations for members.
100%. That I think that that's awesome as well. And it's interesting to hear you mention, the importance of security in providing solutions for health plans specifically. And I believe that I seen your company post on LinkedIn recently that you guys got your SOC 2 certification as well. Could you maybe speak to what that process was like? And I don't know if you guys are planning on getting that, or is that something that the company has recently achieved?
So yeah, great question. We officially received our audit approval last week, which you're
Nice.
right is a huge milestone for us. The good thing is that we basically had all of the policies, procedures, infrastructure set up from day one, but
Nice.
went through the formal process of actually earning that certification. Now, on our roadmap is getting our SOC 2 Type 2, and then beyond that, our high trust certification.
Nice.
But what I think this unlocks is sort of the proof points and a lot of the de-risking of working with us for health plans because now we have that stamp of approval. Everything that we're saying can now be validated by an independent third party auditor. And I think that also helps increase the sales cycle. And maybe there's a lesson in there for other founders in other regulated industries to understand what are those table stakes items? What are those must have things? What are the things that are going to accelerate your sales process? Maybe it's a certification, maybe it's a compliance recommendation, maybe it's alignment with some industry standards, but you can go the longer route and not have that and go through the thousands of questions from the security team to make sure things are validated.
Right.
Or you can do the work up front to get whatever it is that you need to help shortcut some of those sales objections.
100%. No, that is awesome, and congratulations to your team on that as well.
Thanks.
I think you mentioned a very relevant point as far as the way that everybody is looking at AI and especially the way that it's being leveraged in healthcare. I think it's important that people slow down and they really focus on deploying ethical AI solutions and making things are secure just as much as they speed things up. And I appreciate you explaining kind of prior authorization because I always tell our audience, I'm not an expert in healthcare by any means. That's a huge reason why I started this podcast. But I could totally see how you guys are help like optimizing, those workflows as well. But you guys are also making sure that you're not sacrificing clinical integrity with your AI specifically. So I know through getting some of the security certifications that helps. Is there anything else that you guys are doing to make sure, the AI solutions that you are providing are secure, and that not only are they speeding things up, but they're also not sacrificing any of that integrity.
Yeah, it's a great question, and we do that through a few different ways. And I won't highlight everything that's happening on the back end to make that possible, but a few key things are what goes into the prompt engineering and the design of the agentic RAG systems that we're using to structure all that unstructured clinical data. So we're getting dozens, hundreds of pages worth of clinical documentation. Our AI goes through that, structures all of that into discrete fields, allows it to be queryable, searchable, ask questions of the data, but everything also has a citation attached to it. So I can click on anything in the screen. I can go out to the actual source documentation and I can see exactly the page and the paragraph where that information came from. And that allows me as the clinical reviewer, whether I'm the nurse, a clinician, a medical director, to go out and trust but verify anything that I'm seeing. We do that for both the summarization and then we're also just making a recommendation. Our system says, based on the evidence that we found in the medical record, based on your medical necessity guidelines, here's why we recommend approval of this case, and line by line through all of the criteria with those citations back out so you can see where that information came from. And that's the result of the super sophisticated back-end work that we're doing in the checking and the agentic models that we're running to make sure that that data is correct and the recursive loops that exist within that. In addition to that, we're also working with a lot of clinicians to validate all of those outputs. So we built the company with over 50 clinicians, from chief medical officers to intake coordinators to nurse reviewers, to make sure that they first off love the user interface and the workflow, that it's easy to use, easy to adopt, and something that they would want to work with every day, but also ensuring that the outputs are validated. And doing that both through our own in testing internally, but as well as validating it with those outside parties to make sure that they can trust in the outcomes. And I think importantly, what we're also doing is we're not trying to be an AI doctor, if you will. We're not saying interpret these lab results for me and suggest what diagnosis this patient has. We're saying we know everything about this member from the medical record. This is the entire source of truth that we know. And we haven't missed anything, because unlike a human who's going to forget something on page 1 when they get to
Right.
page 432, we're remembering it all of that, semantic embedding, AI's got that all covered. Then we're saying, here are the rules of engagement, right? Here are the things that must be true for this care to get approved. And now put those together and make a recommendation. It sounds simple, it's very complex, but it also allows us to say, this is just a recommendation and it's based on the evidence.
Yeah.
We turn off all creativity. You can't prevent hallucinations. That is something that we actively work on all the time to make sure the data is accurate. But the AI is not making anything up. There's no creativity embedded. Unlike when you go to ChatGPT and throw something in, it's going to bring you back, hopefully, an answer to your question, but it might go outside of that as well and bring in some additional facts.
Yeah.
We turn all of that off in the platform, so it's purely based on the facts.
Oh, wow. That's awesome. I appreciate you going into the specifics there. And for me, when you explain what you guys are doing at Latitude Health, like, it's a no-brainer for why a health plan would maybe want to work with you and your team. But kind of taking a step back and looking at the industry as a whole, I'd be curious to know, like, do you guys have any direct competitors? And I don't want to mention their name and I don't want to talk bad about them, but what I want to do is maybe talk about, a unique value driver that sets everything you guys are doing at Latitude Health apart. For me, I know that if I had to place something on it, I would say it's your guys' domain expertise, just from what we've covered on this call specifically. But is there anything else that you want to communicate out to your customers or future potential customers about your guys' technology? Or, and I know as a sales leader, there's always that one thing that you always want to get across to your customers. Do you know maybe what that one thing would be?
Yeah, I think it's a couple things. I think the first thing is that our domain expertise really shines through, right? We started in healthcare. We understood the workflows, the problems very deeply. In addition to the background I gave you, my mom is a nurse. She started in the call center. I heard these problems firsthand of what her life was like and how she wanted it to be better. So that informs a lot of what we do. And I think that the passion, the mission that brings. But the second is that it means that we actually understand the entire workflow and how these decisions are not just siloed decisions that are about a yes or a no for whether or not care should be approved, but but how that actually relates to how a health plan makes money, how a health plan saves money, how a health plan gets better outcomes for their members, how they manage their provider networks, how they retain their employer customers on a commercial basis, how they align with stars ratings for Medicare Advantage plans. All of those things really actually come back to utilization in different forms and functions.
Oh,
And
wow.
so in addition to our workflow tools, we've also built analytic dashboards on top of that that allow any leader in the organization to be able to come in because the data is flowing through our solution end to end and actually be able to gain those insights that tell them, here's what I need to do differently.
Mm.
Here's how I can take utilization management from this reactive, first in, first out, whatever's next in my inbox is what I have to focus on, and actually turn it into a strategic advantage so that I can get better outcomes for my members, for my providers, for my health plan.
No, that's very awesome. I love that you guys are taking seems like more of a holistic approach into how you are dealing with some of these utilization management workflows and helping people respond, like you mentioned, instead of react. So I think, your guys' mission is super powerful. We've covered like how you guys are differentiating yourselves in the market. I really wanted to drive this home. And Chuck, I would love to maybe dive into a specific use case if you're at the liberty to talk about maybe a recent project that you guys have worked on with the health plan. Maybe we don't mention their name, or maybe we can just give a high level overview, but I would love to drive home the point of a specific use case, because as you see in the news with articles that are coming out from sources such as MIT, a lot of AI pilots are failing. And so I want our podcast to be a place to where people can always refer back to a very specific use case that they can go and research further and seeing what some of the real world application looks like for AI, specifically in this situation in healthcare. So is there any, I guess, specific projects you guys have worked on recently that maybe we could highlight?
Yeah. I also kind of want to address the MIT study because I think it's really interesting to say that 95% of AI projects fail. I
Right.
think when you look into the details, it's a lot of internally built AI solutions that
Mm,
fail, and often ones that are trying to be very broad in nature. Whereas on the inverse side of that, we've built a vertical SaaS company that's AI native at its core, right? AI powers everything that we do, but it's specifically focused on this function. And the goal is actually eliminating a lot of the administrative work that happens today
right.
that is not where somebody should be operating at the top of their licensure. And if you look at that subsegment of companies and people that are taking that approach, you actually see a very high success rate because of the obsession with the problem and the specifically crafted AI and the combination of that with a modern front end that actually deliver on the promise of what it's trying to achieve
Yeah.
versus just saying do AI across the board and let's see if it works. So within that, an example of one of our recent successes is in addition to everything that I've talked about on the clinical review side of the equation for our customers that are using that, we've recently launched our intake functions as well. And whether or not we say it's the worst thing in the world or it's just the nature of the beast, a lot of healthcare still runs on faxes. And what we've been able to do is say, even if that's the case, we're going to make that a moot point for you as a health plan. A lot of health plans today have teams of intake coordinators that are just opening faxes and hand typing things from one system into another system. We've built a solution that automates that entire function. It
Oh, wow.
combines OCR with pulling out the information from the faxes or from an email in a prior request form, but it
Nice.
then contextualizes it to understand what that is. So is this a prior auth request? Is this a concurrent review? Is this an appeal, a grievance, a complaint, a dispute? And then we need to route those to the right team because as soon as we get that fax, the clock is started on our turnaround time.
I love
And so in addition to the clinical review, we're also seeing massive cost savings for our health plan customers that are using that solution to do all of the componentry across from appeals and grievances to prior auth to concurrent review and automate that data intake such that their teams can focus on the cases that actually matter. And for those that are ready to go to the clinical reviewers, can get routed directly to those team members to deliver better, faster decisions back for the member and the provider.
Yeah, that is awesome. It's so great to hear about, like, the specific use cases in this case. And I was following you as best as I could, but I think it really demonstrates your guys' domain expertise and how you're able to take, as you mentioned, your overall goal of turning some of those manual administrative processes into something that can be streamlined. So, it's awesome to hear about that. And I would be curious to know, kind of as one of the last questions here is, do you guys have any new initiatives that you'll be rolling out with your technology in the next 6 to 12 months that maybe the audience can be on the lookout for? I guess?
Yeah, a number of things, and Guru will probably yell at me for forgetting some of our major milestones that are coming up. But the top of mind ones come down to a few things. One is just continuing to build out this entire end-to-end function for utilization management. We, whether it's sexy or not, we live, eat, breathe, sleep utilization management because there's so much within it. It's not just that clinical review; it's all the domains across that. And so, in addition to that intake function, we'll be rolling out the clinical review function for appeals and grievances.
Nice.
Think of this scenario where your doctor requests a service, the health plan denies it because the care was inappropriate. Now the member or the doctor is saying, hey, no, actually, I'm appealing this. I think that this should be covered. I want you to look at it again. And this means that you're not only re-looking at that request, you're probably also getting another 1,000 pages worth of medical information that you have to pour through in support of that. And so there's a different workflow required for that, but we help those decisions get made more quickly as well. And appeals and grievances now tie back to STARS metrics for medical or Medicare Advantage plans because CMS wants to see, hey, if you've denied something the first time and then it gets appealed, we actually don't want you to see it get overturned. You should have either approved it in the first place or you should be confident in the reason that you're denying it. And then you should probably focus on what that member actually needs for their care
Yeah.
because this surgery isn't right, but they do need something. So you should go be working with them on that.
Yeah.
So that's one big piece. And then the second piece is actually setting up the communication that goes back to the members and the providers. It sounds trivial, if you will, like, isn't it just taking a template of a letter and sending it back to the provider and the member? But that's where a lot of this frustration comes back in when you or I receive a letter that says your care was denied, but it doesn't explain why. It doesn't explain the guidelines that were used, or it doesn't explain it in a sixth grade reading level so that we can actually understand it. And so what we can do is take all those templates and make any denial letters that do go out actually based in the evidence, based in the guidelines, but also understandable for the member and the provider,
Yeah.
such that they understand why care gets denied, which then inevitably cuts down on those appeals that go back and allows the member and the provider to actually say, what's the care that is the most appropriate? Because we're not going to win this battle because the health plan is actually right in the medical necessity guidelines here. So let's focus on what actually matters.
100%. I mean, that is super awesome. And for anybody in the audience that wants to keep up with what Latitude Health is really working on, or maybe they want to connect with you, Chuck, and follow along your journey as the leader of the company outside of the website, what would be the best social media platform for the audience to go and connect?
Yeah, so we're on X, we're on Instagram, although I'd say our presence is pretty low there. But find us on LinkedIn. We've got a very active LinkedIn. I'm very active on LinkedIn. If you want to get in contact with me, that's the best place to come find me.
100%. And I'll be sure to include links in the description of the video to your guys' LinkedIn, to the other social media accounts, and to the website as well. I highly recommend everybody go check out Chuck and Latitude Health and all the awesome stuff that they're working on. But, for us as a podcast, one of our main goals is attaching our brand to companies that are making a real impact in AI. So I think that the episode that we recorded today, we were able to accomplish that mission. So just wanted to tell you again, Chuck, thank you so much for joining us on the podcast and sharing your insights.
It was such a pleasure. I hope I added some value to your audience. And yes, anybody does have any questions around AI, sales, healthcare, don't hesitate to reach out. It's a small industry and we're happy to continue the conversation.
100%. And feel free to leave a comment on this video if you guys see it on YouTube, or you feel free to comment if you see it on LinkedIn as well. Other than that, we will catch you guys in the next video.